let's go to the most recent study that you have done, and that's the elevated in vitro strontium-90 from nuclear weapons test fallout among cancer decedents, case control study of deciduous teeth that was done by you and Joseph Mangano. Now, what are we looking at here? This apparently was radiation that was released from above ground nuclear testing that took place from 1951 to 1963, 12
Right.
years. And I think I'll let you tell us what we're looking at here.
Well, the original study was very interesting. It was done in St. Louis, and dentists down there collected baby teeth.
Okay, we're talking St. Louis, Missouri.
Yes.
All right.
Now, baby teeth are very useful because they are laid down during intrauterine development and early childhood.
Okay.
When you have strontium-90 did not exist anywhere on Earth before the first atomic bomb was tested at Alamogordo.
Okay.
So essentially there should be no strontium-90 in anybody's body or in anybody's teeth.
Because there was nothing generating it, correct?
It's entirely man-made.
Right, got you.
Okay, what they did is they collected, I think, hundreds of thousands of teeth from citizens, and they got the name of the child, where the child was born, where the mother lived during pregnancy, and then they found that during certain years of the test years, the strontium-90 levels went up in baby teeth. And this showed that there was radioactive fallout from nuclear testing landing on St. Louis.
Okay, so the health, is it the health department in St. Louis, Missouri?
I don't know. I think it was the university. It was the University of St. Louis.
Okay, University of St. Louis
Did the study.
asked people to send in their teeth.
Right, and dentists...
Baby teeth, the ones that people,
and
you lose.
dentists all over promoted this
I see,
extensively.
I
and
see.
It was,
So there's this huge collection
database, huge
of
collection.
teeth.
Right. Huge
And,
collection.
and each set of teeth that's sent in identifies the name of the child,
Right.
where they're born, this kind of thing, and so forth.
Yeah.
Okay, so what do you do with all
Whether
this?
the mother breastfed or
All right.
fed. There's a tremendous database. Now, they did publish these data early on, and that's one of the reasons that led to the stopping of the above-ground nuclear testing. A colleague of ours by the name of Marcia Marks was from St. Louis, and she went down and actually boxed up and sent the teeth to the Radiation and Public Health Group.
Okay.
Actually got them physically because the university was going to...
Now, this was a smaller set of teeth. And my understanding was like 84,000 teeth that were sent to
I don't remember how.
Okay.
There was a lot of teeth.
Right, right. But it was not the total amount that they had in their collection.
Well, they had already tested a lot of them.
I see, I see. But
lot
these
of
were untested.
These were untested teeth.
Gotcha.
And a Radiation and Public Health group that I work with got the teeth, and then we started looking at what's the health outcome of these people who were born during the years of the testing. So Mr. Mangano sent out, we decided we'd look at men because men don't change their names when they get married. And women do, so it's easier to follow men. And he sent out inquiries to as many of the people that we could locate either by on the internet or through Social Security or through the other databases. And we got responses from a number of people, and then we asked them about health outcomes. I mean, we were able to determine, you know, who was alive, who had died, and what people who had had cancer. Then we tested a number of the teeth to find out, was there a correlation? You know, and they were tested blindly.
Okay.
So the person who did the testing didn't know if it was a live person, a dead person, or cancer or not cancer.
I see, okay.
And we
And then you ran your comparisons.
Then we ran our comparisons, and we found that the people who had developed cancer, there were higher levels of strontium-90 in their teeth. And this means that they were absorbing radioisotopes. So not just
Which also proves that the radioisotopes were causing their cancer.
I would like to make that statement, but we're saying that there's a link
I see.
That
Now, why are we being cautious here? Is that because of the way the science is approached?
The way the is because it's not just it's not just strontium-90, but when you have strontium-90, you also have cesium-137.
Okay.
You have iodine-131.
So why not examine all of them?
Well, there's not enough money to look at all of
That's
these.
the problem. I see.
And
In fact,
and this group is extremely poor.
well, that leads up to
as far as economics.
When I read this study, this leaped out at me, and I think we're right there. You know, in your study, you state that, and I quote, studies evaluating human carcinogenesis through the use of in vivo measurements, and in vivo, as I understand, means in the body, okay, of strontium-90 have been almost non-existent. And then later on in the study it says, for more than 4 decades, there has been no published research matching in vivo fallout with health effects. Now, you know, this is where I have a hard time understanding what we're up against here. You have this huge body of information that can give you some definitive understanding of what it means to be exposed to radioactive material, but you're not doing the studies. Why? Why is it taking all these years to get to you?
Well, the government doesn't do it.
Why?
I don't think they want to know. Now, there was an interesting study done also by a colleague in New York State who was a surgeon in New Paltz, New York, along the Hudson. And as you know, the Hudson River has been declared as a Superfund site because of the PCBs leaked into the Hudson River from the GE General Electric plant that's upriver.
Okay.
Anyway, he was a breast surgeon, and he took for samples, little samples of breast tissue. You'd only need about a half a teaspoonful. And from women who had cancer and women who didn't have cancer, and they measured PCBs and various pesticides that are commonly used in the fruit orchards along the Hudson River.
Okay.
And they found a higher level of pesticides and PCBs in women with breast cancer than those without breast cancer. Now, we're not talking rocket science here. This is relatively simple stuff to do, and it's not terribly costly. The government is not doing it. States are not doing it. And people like Radiation and Public Health, we don't have the funding. We're very limited on funding.
How did you manage to do it? How did you?
On a shoestring.
Really?
Yes.
And how did you get your resources? How did you go about pulling this together?
Well,
do you have to scramble?
Joe and I don't get paid. The funding for doing this was given by private citizens.
Okay.
Some from a number of people from St. Louis.
Right.
And we did it.
And that's how this study got done. It's amazing.
Yeah, the government could do a lot of this, but they don't.
At the end of your study, you have a section on, it's entitled Findings Consistent with Studies Detecting Harm from Low-Dose Radiation Exposures. My question is how does your findings and the findings of these other studies affect the assumption that radiation exposure below a certain threshold dose poses no health risks?
Well, we don't know what the threshold dose is.
Okay.
And we do know from the National Institutes of Health, we do know that every single exposure to radiation carries a risk.
Okay.
Now, when do you go over that threshold?
That's the question.
Is it because you've had CT scans or tooth x-rays or exposure to radioisotope fallout from nuclear power plants?
So you're talking cumulative.
Yes.
Over time, if I'm running into various radiation exposures, I'm building up this health effect.
Right.
Basically.
And we don't know
where you cross the line.
Or whether it's different for you or me or a 3-year-old child.
Well, what then does that, I mean, what kind of confidence can I get then from the various radioactive standards that have been set for workers, for people, for medical technicians, for myself? What you know, I guess we're back in that question again about how do I protect myself from this particular problem? I mean, what do you do here?
It's very difficult because, as far as I know, standards have been lowered over every decade.
Right.
And they've never gone up. And I think the only thing we have to be alert to is that we need to minimize every exposure that we have. And we need to, as a public health program, We need to limit the overall public's exposure to radioactivity.
Okay.
And the only way we can do that is through education of the public, because the government, by and large, right now, is so controlled by big corporations that it's very difficult to move this government to do anything.
It's hard, it's hard for people to hear this because, you like to think that the government with its resources is in the job of protecting you. But basically what you're saying is the government is part of the problem. They're not doing their job. And I've got to, lay people have got to pull themselves together in order to provide that level of protection. And that's still what we're confronting today.
Right. Well, it was the public who got the vote for women. It was the public who stopped treating blacks as second-class citizens. It was the public who got the Vietnam War stopped.
Right.
It has to be the public
that demands this protection.
That's the only source right now
All right.
of getting what I think should be universal health care and stopping of known cancer sources.
You have a similar statement in here to what Yablokov and the Nestorenkos basically concluded in their Chernobyl book. You state that, quote, extended exposures from reactor emissions may, in time, compare with exposures from bomb test fallout.
Yes.
As a part of this study. Now, the thing that immediately leaped out at me on this is, when you made this statement, were you talking about the number of existing reactors that we have in the world right now that are operating? Is that what you're linking that to?
Yeah, there's about 400 reactors.
To me, that immediately raised a concern, because we've got now people that are using, not just using, but they're concerned about the problems of global warming. I'm concerned about the problems of global warming. And they're saying we've got to go on this massive program to construct a large number of nuclear plants to respond to this particular problem, because nuclear power doesn't emit carbon, or at least the operation of the plant itself doesn't emit carbon. Actually, when you look at the fuel cycle, there is a carbon contribution that takes...
It's a huge carbon contribution.
Right. Okay. So, but nothing like coal. I mean, we got to be clear. It is nothing like coal. So this is not a false effort here as far as trying to reduce carbon emissions. There would be reduction in carbon emissions if you went to nuclear power. The problem, though, is if I add that 700 gigawatts, which is about 700 more nuclear plants that some people talk about that we need, doesn't that push this radiation exposure way beyond what we would have experienced from above exposures from bomb test fallout?
Oh, sure. It'd make it much, much worse. Right now we've got about 400 reactors worldwide.
Right.
And we already know that from the German studies that there's an increase in childhood leukemia in children living in proximity to nuclear reactors.